Okay, so I had a new patient come in last week, and she's been on birth control for PCOS for 3 years. And she asked me a question that honestly broke my heart. Why am I still struggling with all of my symptoms if I'm taking medication? And I had to tell her the truth. Birth control is not medication for PCOS, it's a cover up. Hi, I'm Andrea from Renew Integrative Health, and let me explain what's actually happening to your body. PCOS affects up to 21% of women of reproductive age. And here's the thing most people don't understand: insulin resistance is a significant driving force in this condition. When you have insulin resistance or hyperinsulinemia, your body cannot properly use insulin, which then triggers your ovaries to produce excess androgens like testosterone and DHEA. So, what does birth control do? It shuts down ovulation completely. Yes, it might regulate periods, clear up acne, reduce hirsutism, which is excess facial hair, or help with alopecia or scalp hair loss. But it's not addressing the underlying hyperandrogenism or insulin resistance that's causing all of this. With PCOS, there's an alteration in your gonadotropin secretion. That's your LH and FSH hormones. Your ovaries and adrenals are producing too much androgens, leading to what we call hyperandrogenism. You might have irregular periods, absent periods, infertility, weight gain, obesity, acne, or those dark patches on the skin called acanthosis nigricans. Insulin resistance isn't just about blood sugar. It increases your risk for type 1 and type 2 diabetes, elevated lipids, which is fat, cardiovascular disease, non alcoholic fatty liver, sleep apnea, and even mood disorders like depression and anxiety. This is a metabolic and endocrine disorder that needs metabolic solutions. Instead of suppressing ovulation with oral contraceptives, we need to address the root cause. That means tackling the insulin resistance head on through dietary interventions, resistance training, focusing on large muscle groups like hamstrings, quadriceps, and glutes. This type of training improves insulin sensitivity and glycemic control by increasing glucose uptake, improving how your muscles respond to insulin, along with targeted supplements like myoinositol, berberine, alpha lipoic acid, chromium, N-acetylcysteine, gymnema, which is an Ayurvedic herbal therapy. The goal isn't to just stop symptoms temporarily. It's to restore ovulation, achieve regular menstruation, reduce those hyperandrogenic symptoms such as excessive hair growth, and actually heal your body from the inside out. In my next video, I'll talk about PCOS and fertility, whether you can still get pregnant, and exactly how to reverse these patterns. Drop a comment if you've been told birth control is your only option for PCOS.